It was a case of, well, the more arrests you had, the better job you were doing, and we thought we were actually doing people a favour by putting them in jail if they had a drug problem.
What does a supervised injecting room actually do for the user? I'm thinking here about somebody who's never been inside one, doesn't know anybody that's been inside one. Could you describe for us why they are beneficial to a user? Many
people who are, I guess disadvantaged, often cut off from mainstream health services, they're often dysfunctional or chaotic in their drug use, they may be street-based, don't have a chance to engage with people who are there to help them, like medical health professionals. So when a person goes into a supervised injecting facility, they're not only in a safe environment if they overdose, but they also have the opportunity to, I guess, build a relationship or get to know staff there who have ready access to a range of services that can provide some benefits, say housing, employment, and especially drug treatment programs. So it's not just about safe injecting practices such as ensuring that people don't do themselves further harm when they're injecting, and also about preventing overdose, but it's also about referral processes.
What about in terms of overdoses though? Does it actually stop deaths relating to overdoses?
There are about 100 supervised injecting facilities, consumption rooms worldwide. There's never been an overdose death in any of those 100 facilities. There's never been one in the Sydney Centre, which has been operating for 17 years. So it's a bit like, I guess, swimming between the flags at a beach. It's safe. That's the major benefit for people who use drugs.
Are there things happening in other parts of the world that you would like to see here in terms of how we go about treating drug addiction?
If you look at Portugal, for the last 16 or 17 years, they've decriminalised all drug use. And again, when that was introduced, there's a lot of scepticism. But what they did was they got a group of people together who were experts in the field. They actually listened to the experts and they implemented what they suggested, which was to decriminalise all drug use. What they did was, though, that they saved a lot of money by not using the criminal justice system, particularly police and the court system and the prison system, and also the costs of police enforcing the law. So they saved a lot of money, and they put that money into education programs, health programs, medical programs, hospitals, and they're reaping the benefits now. The rates of drug use are far less than they are for other European countries, and that's something that I think we should be looking at now.
Sounds like a pretty common sense idea. Greg, thanks so much for joining us today.
Thank you.